All right, let's talk about something that's absolutely critical in medicine. What happens when the body's own defense systems go into overdrive? We're going to break down this whole process, from SARS to sepsis, and make it super clear. You've seen the scenario, right? A patient comes in, heart racing, breathing fast, with a fever. But what's really going on under the surface? Is it an infection? Or could it be something else entirely? That's the mystery we're going to solve today. Okay, let's dive right in. There are a few key terms here that can get really confusing. SARS, sepsis, septic shock. We're going to clear all that up and show you exactly how the body's crisis mode escalates. So, here's our mission. We are going to create a crystal clear map of this whole pathway. You'll see how a simple infection can spiral into widespread inflammation and then, tragically, into organ failure. First things first, we have to start with the body's general alarm system. Think of it like a building-wide fire alarm. It doesn't tell you where the fire is, just that there is a fire somewhere. In medicine, we call this alarm SARS. So, what exactly is SARS? Well, it stands for Systemic Inflammatory Response Syndrome. And the most important words there are systemic and generalized. This isn't just a little redness around a paper cut. This is the whole body screaming that something is seriously, fundamentally wrong. Now, this is absolutely crucial. What can trigger this alarm? Well, sure, an infection like pneumonia can do it, but so can a major car accident, a bad case of pancreatitis, or even the stress of a major surgery. The big takeaway here is that SARS is the alarm, but it doesn't automatically mean there's an infection. So how do we know for sure that this alarm is actually blaring? We look for 4 specific things. Is the heart rate over 90? Is breathing faster than 20 breaths a minute? What about the temperature? Is it really high or surprisingly really low? And finally, what are the white blood cells doing? Are they super high or super low? These are the clues. And get this, the rule for diagnosing it is so simple. If your patient checks off just 2 or more of those 4 boxes, they have SARS. That's it. It's a really powerful and straightforward way to know you're in trouble. Okay, so we've established the alarm. Now things get interesting. What happens when we figure out why the alarm is going off? This is where everything pivots. I want you to think about this like a simple math problem. The first part of our equation is SARS, that big system-wide inflammatory response we just talked about. The body is on high alert. Now let's add the second piece of the puzzle. We find the culprit. We either prove or have a very strong suspicion that an infection is what triggered that alarm. And boom, you put those 2 things together, the system-wide alarm of SARS plus an infection. And what do you get? You get sepsis. It really is that simple. If you remember one thing from this whole explainer, make it this. SARS is the what. It's the inflammation itself. Sepsis is the why. It's that same inflammation, but we know for a fact that an infection is driving it. That distinction is everything. So, once we know it's sepsis, the clock is ticking. This is where things can start to go downhill and fast. That massive inflammatory response isn't just a warning anymore. It's actively starting to cause damage throughout the body. This brings us to the next level, severe sepsis. And the definition is right there in the name. It's sepsis, but now we're seeing clear signs that the body's organs are starting to fail. The body's own defenses are now harming its own critical systems. And what does that look like in a patient? Well, their blood pressure might be dropping, their kidneys might slow down, producing very little urine, the lungs struggle to get enough oxygen into the blood, you might even see the platelet count drop. The body is clearly struggling to keep up. If things keep getting worse, we hit a really dangerous stage called septic shock. Here's the key difference. We're now in a state of circulatory collapse. The patient's blood pressure is dangerously low, and, this is critical, giving them IV fluids isn't fixing it. They now need powerful drugs called vasopressors just to keep their blood pressure from bottoming out completely. And from here, we entered the final, most devastating part of this cascade. This is where the body's systems begin to shut down on a massive scale. So let's just quickly walk through that whole tragic path. It all starts with sepsis. That's our infection plus inflammation. Then it escalates to severe sepsis as organs start to struggle. From there, it can become septic shock, where the whole circulatory system fails. And the final, terrible step is MODS, total system failure. And that brings us to the end of the line. Multiple organ dysfunction syndrome, or MODS. This is exactly what it sounds like. At least 2 major organ systems, like the lungs and the kidneys, have failed. The body can no longer function on its own. The person now needs life support, like a ventilator or dialysis, just to stay alive. All right, let's zoom out and look at the whole picture one last time. It can start simply with bacteria in the blood. That can trigger SARS, the body's big alarm. If that alarm is from an infection, it's sepsis. If the circulation fails, it's septic shock. And if multiple organs give out, it's MODS. When you see it lay out like that, the progression is just undeniable. And that really brings us to the most important question of all. We've just mapped out this entire domino effect, from a general alarm all the way to total system failure. So I'll leave you with this. Knowing what you know now, just how much of a difference does it make to catch that very first alarm, those initial signs of SARS, as early as humanly possible? It changes everything.